Hello. A big good evening to Ashu, Richa, Mulai, and Sona. Hello, everyone. So we'll start with the salivary glands MCQs. Okay, salivary glands. We are going to look at some of the nice questions which has got even the answers. So I'm going to tell you how to remember that. And if you have any questions or queries, you can definitely post. And we'll start with the MCQs. Okay. So let me just quickly upload that for you. Hey, Ankita. So here we have salivary glands. It's mostly the clinical aspect. So it will be definitely interesting and it is something that you will download and save it. All right, so here is a quick introduction about myself. I'm Dr. Rohini and you all know me that I'm from Mangalore, KMC, Mangalore. And this is in Karnataka. And I don't know how many of you are from Karnataka, but this is a very nice deemed university, KMC, Kasturba Medical College. Actually, it is belonging to this Mahe, Manipal Academy of Higher Education. This is one of the finest universities. So you go anywhere around the globe, you will be able to get a job because this itself, carries so much of weightage. I didn't have to separately give any separate interviews or I didn't have to go on explaining from where I am, what I am, all these things. The moment they saw the Manipal Academy of Higher Education degrees, they just approved my, degrees. And we have to go through a form called the Global Credentials, and they just, test all your degrees and they'll check whether it is genuine ones or fake ones, and then only they will approve. So they'll give you another certificate stating that all these marks, cards, and certificates have been evaluated. All right. Good evening, Rishabh again. Yeah. So it was a very short break, but yeah, you are welcome back. So here I also have PhD from Savita University, and these are the degrees which I procured from the USA. Okay. So let's go to the questions. All right. So now this is a quiz 7. Okay, just wait. All right. This is not the one I wanted to actually. Okay, so here is the questions. The first one. So now first one says, just go through the question. You also read with me so that you are understanding the question. So it's always very important you read the question by yourself and gain understanding of the keywords that are given in the question. Loss of sensation from the temporal region. So we are talking about temporal region, loss of sensation and loss of secretory function and sensation of the parotid gland would be caused by interruption of which nerve? Now you tell me, just make a guess in case you're not sure. Now who can tell me? Ankita, Richa, Ashu? Do you think, Aaron, you think it is A, auriculotemporal? All of you think it is A because auriculotemporal is not just sensory, it is also the secretomotor to the parotid gland, right? So it is A. Without any, thinking, we can simply bank on the answer A. But let's go to the, section where the answers are there. You may get some more points, which is equally important. That's why you need to download the PDF. Okay, now here, because sometimes we would read few lines and then some of the things we might have just, not read. Auriculotemporal nerve, it is a branch from the mandibular. Okay, so mandibular, you know that there is anterior and posterior. The posterior is all sensory and there is only one motor, and anterior is all motor and there is only one sensory. So keep this in mind. So this, out of this sensory, you remember ALI, okay? Ali, you remember. And that A is the auriculotemporal branch. All right, so it is a sensory one and it carries postganglionic parasympathetic fibers to the parotid gland. And when it carries this sensory supply, it is also hitchhiked on this. The postganglionic parasympathetic fibers are also hitchhiked on the nerve and it reaches the parotid gland. So it comes from the otic ganglion. It relays in the otic ganglion, comes from the otic ganglion, and they are synapsed with the presynaptic fibers from the glossopharyngeal nerve. Okay, so the auriculotemporal nerve provides sensory as well as the parasympathetic, but it is sensory to what? It is sensory to skin of the anterosuperior part of the ear. Anterosuperior part of the ear, externally auditory meatus, and also TM joint. Very, very important. Why it is very important? Very, very important. You must have seen whenever there is a infection in this region or extraction of tooth in this region, the TM joint also hurts. Even though you have not done anything to the TM joint, you will experience pain in the TM joint. That is because of involvement of auriculotemporal nerve. Yeah, you can also list this under Fraze syndrome. Fraze syndrome is because of which one? Which other nerve? Okay, auriculotemporal nerve is involved, but what is the other nerve? What is the other nerve? It is the nerve that supplies the sweat glands. What is the nerve? RN? Greater auricular nerve. Okay, because of anastomosis between these two, there is always wrong signaling. Whenever there is salivation, there is also sweating in this area. That condition is known as Fraze syndrome. Okay, hey Lakshmi Priya, Dr. MD. All right, next one. Who can answer this question? Let's see. Read the question carefully. See, always don't think that the questions are lengthy. Let me skip one line. All that should not happen. So read the question carefully. Elderly man, okay, keyword. Presented with severe pain. Where? Beneath the left eye. And where does it radiate to? Lower eyelid. Okay, lower left eye to the lower eyelid. Lateral side of the nose, upper lip. What nerve is involved? What nerve do you think is involved? Buccal, infraorbital. Then there is mental, supratrochlear. Supratrochlear will come in the forehead region. So they're not talking about this region at all. So let go of that. Zygomatic would be, zygomatic is going to supply the orbicularis oculi area. So that also, let go of that. Mental is way down. Let go of that. Buccal is here. The answer is B. So what you have to do, first you have to try to eliminate what is irrelevant. First thing I would eliminate is, which one would you eliminate, Aaron? If you were me, what do you think? What do you think you would just get rid of first? Not pick the right answer. You have to try to get rid of what is not. I would be just trying to get rid of mental. Okay, mental branch. First, I will remove that from the picture. So once this is gone, then I'll have less options to think about. Then I will remove this one. Okay, like this, I will go on removing what is irrelevant. So let's see whether the answer is B. Yes, it is B. So it is infraorbital. It is a nerve, cutaneous nerve from the maxillary division of trigeminal. It is maxillary part that comes, trigeminal maxillary. Innervates the skin of the lateral nose, lower eyelid, Upper lip. So this, remember, upper lip, you please remember, very, very important. It has been asked so many times. Upper lip is invaded by which nerve? The infraorbital. Which branch? The cutaneous nerve. Okay, cutaneous branch. So now here also the zygomatic region. This is exactly where the man was complaining of the pain, right? It's like his pain must be transmitted on the infraorbital nerve. So exactly the distribution of infraorbital nerve he was telling. So the answer is infraorbital nerve. Next, Ragul, you have to answer this. Ready? Kirti, you have to answer this. Let's see this one. During a facelift operation, okay, during a facelift operation on a 48-year-old man, 48-year-old man, facelift operation, plastic surgeon, okay, he cut the marginal mandibular branch of facial nerve, marginal mandibular branch of facial nerve during the procedure. Now, which of the muscles would be paralyzed? What is the supply? The 5 branches like goose feet. You have temporal, you have zygomatic, you have marginal mandibular, then you have you have the buccal, then you have the marginal mandibular, then you have the cervical. Now tell me, which muscle do you think is paralyzed? Aaron, which one? Lakshmi Priya, which one? Kirti, Ragul, which one? Minaz, which one? A, buccinator, depressor anguli oris, levator anguli oris, levator labii superioris, stylohyoid. Stylohyoid. Stylohyoid is definitely not. Why? Why? Anybody can tell why it is not. Of course, it is supplied by facial nerve, but where? Is it the terminal branches that supply? No, it is supplied in the neck. It has, see, once the facial nerve exits out through the stylomastoid foramen, once the facial nerve exits out through stylomastoid foramen, it gives 3 branches, correct? What are the 3 branches? One is for the posterior belly of digastric. Another one is posterior auricular. The other one is the stylohyoid. So it is already done. And later it enters the parotid and gives 5 branches. So the branches of facial nerve are 3 plus 3 plus 5. Total 11. Okay, 5 outside and 5 soon after it exits. This is through extracranial course. This is through intracranial course. So remember the numbers very clearly. Many times they ask that also. So let's see what is the answer. So you all think the answer is A, right? So let's go with the answer. What was the answer? Buccinator. Buccinator is supplied by what? Buccinator is supplied by what? Buccinator is supplied by buccal branch. Why buccinator would be supplied by marginal mandibular? So it has got the buccal branch. Okay. So it is not buccinator, it is depressor anguli oris. All the elevators will be above. So all the elevators will be above. So levator, all cancel. Stylohyoid cancel, buccinator cancel. So only thing left is B. Depressor is down. So this area is mandibular branch. Okay. So answer is depressor anguli oris. So marginal mandibular provides motor innervation to muscles of facial expression near the lower lip and chin region, okay? This region. And right where you find the depressor anguli oris, not elevators will be above upper lip, not down. So now here you have to remember that area when facial nerve is damaged by and that small branch is cut, this is what will be paralyzed. Depressor anguli oris. So it's good in one way. You will not have a depressed this kind of face. That is like this face. Okay, pulled down. So instead of that, you'll be always smiling. Just for joke. Shamadeep, next question is for you. So here you tell me what is this? As a result of a facelift operation. Okay. 46-year-old woman. She noticed asymmetry of inferior lip and could not fully depress the angle of her mouth. Inferior lip. Okay, it's asymmetry there. And could not fully depress the angle of her mouth on the right side. Which of the following nerves are most likely to be damaged during the surgery? You tell me which one. Now again, go back to the same thing and see. Shamandeep, Ashu says it is zygomatic. That is this one. Zygomatic is here. You think here? Zygomatic branch supplies orbicularis oculi. If he was not able to close his eyes, then you can say that. So it is not a buccal, mental, marginal mandibular, infraorbital. Again, it is again angle of the mouth. It is here. Angle of the mouth is which one again? Think, think, think. Nikunj, you don't want to change your answers. You want to stick to the same. Let's see what is the answer. The answer is D, marginal mandibular. Why marginal mandibular? Again, we are talking about the same muscle. That is depressor anguli, anguli oris, angle of mouth. Why? What is so confusing? Why are you giving wrong answer? Depressor anguli oris. See here, angle of the mouth. She was not able to depress. Very simple. So again, same thing. That angle is, the answer is D. Okay, the answer is D here. So now let's go to the next one here. It's innervated by marginal mandibular. So if the marginal mandibular is damaged, then this is paralyzed. So you can imagine how, questions can be framed. They can trick you with the same question by turning and twisting the question. Next one here. Now tell me of this one. See, there is an elderly woman. Okay. She is complaining of severe pain. But where is the pain? It's above the right eye. Just above the right eye. Okay. It radiates to the upper eyelid. Above the right eye, radiates to the upper eyelid and to the side of the nose. And to the forehead also. What do you think? Forehead. See, remember forehead. That area is also involved. So what do you think? Branches of which of the following nerves convey pain sensation? Think, think, think again. Pain sensation. See, this is Ashu. It is pain. So it is sensory. Sensation from areas of skin that is described. Now this area is what? Is it facial again? You think so? Think, read again. See, I told you it is pain and it is sensory innervation. Sensory is by trigeminal. So it has to be one of the branches of trigeminal only. So first thing I will remove is the facial one. So you think it is C? Yeah, all of you got it right. All of you got it right now. So it is facial which I will remove first because this is motor. Okay, then great auricular also I will remove because it is behind the ear. Okay, this is again of course skin, but where? Behind ear. Not in front. So I will remove this also. But again it is in the maxilla region. So it is not mandible. So I'll remove the mandibular division. And the debate is between A and C. Okay, A and C. Just because they said forehead. Just because they said forehead, I will come and answer it as Ophthalmic. The answer is C, because they said forehead. If they hadn't said forehead, then that wouldn't have been an answer at all. So here you should remember sensory innervation to skin of the nose. This portion of the nose is supplied by the ophthalmic. Okay, this bridge of the nose up to the tip of the nose. Actually, tip of the nose is if you get a pimple and if you have an infection there, it's all drained by the internal carotid. Okay, so you have to remember all this is supplied by the ophthalmic branch. So here it is exactly where this woman feels the pain, right? Ophthalmic division of trigeminal must be the nerve transmitting the pain from this region. So she has pain on the skin of the nose, upper eyelid and forehead region. Okay, next one. Due to multiple salivary canaliculi or stones in the submandibular duct. What is the name of the duct? It is Wharton's. Okay, there is multiple stones. The lady, the person or individual is 45-year-old and he got it surgically removed. What majority artery directly related to the gland? So which artery supplies the gland? What do you think? Was a special concern to the surgeon? Which one supplies the gland? You tell me. Submandibular is supplied by which one? Is it lingual, superior thyroid, facial, ascending pharyngeal, maxillary? Which one? Majority, what? Majority, major artery. Okay, what major artery directly related? You have to tell the one which is directly related. So you think it is lingual, superior thyroid. You see, they are removing the submandibular gland. They're not worried about its blood supply. They are talking about damaging, getting it damaged. So which one is close to it will get hit by the or will be damaged by the surgery. That is a concern. So which one is close to this gland? You have to think like that. Where will lingual go? Where will ascending pharyngeal go? Where is maxillary? It is somewhere it is above. So you think the maxillary will go here, submandibular. Maxillary is here in this region. So think like that. Okay, so the answer, let's look at the facial artery. Okay, the facial artery is where it is crawling in front of the masseter, correct? It winds towards the inferior border of the mandible. It is the fourth branch from the external carotid artery. And it crosses over the submandibular gland. It grooves actually. So if the submandibular gland is removed, the facial artery may be damaged during its course. So the answer, how many of you said C? None of you said C. I think Ashu said C. Okay, so none of you else said C. So you have to think over your answers and then answer it. Okay. So I was not talking about the blood supply of the submandibular getting affected. I was talking about getting damaged. See, read the question. It's very clearly given. So here, removed, and what major artery directly related to the gland was special concern to the surgeon. So what does that mean? It means which can get damaged during the surgery. That was the concern. Okay, so they didn't say it will affect the blood supply. They didn't say that. Next one. Coming to the next question. To study the compensatory response of selective suprahyoid muscles in the elevating the hyoid bone. Okay, which one elevates the hyoid bone? Experiment was designed. Okay, where posterior belly of digastric and stylohyoid muscles were paralyzed by some drugs. Now, the muscular branches of which of the following nerves must be chemically interrupted to produce paralysis in these two muscles? Now, which nerve supplies these two? I just went to go back to what I just told you about. It's one nerve. I told you it has 11 branches. Which nerve is that? So go to the branches of that nerve. RN thinks it is, what is the answer, RN? What's your answer? Is it inferior alveolar? Is it facial? Inferior alveolar is within the mandibular canal. Facial, where is facial? Facial has supply to these two, posterior belly of digastric. It has stylohyoid and it has supply to posterior auricular. Okay, these three muscles. That is facial. So you have to remember facial is the one which could be paralyzed. So now interrupted to produce paralysis in both the muscles. So that is what is interrupted with the chemicals. So now here, this is the answer. The answer is B. It is not hypoglossal, that is the 12th cranial nerve, and it supplies the tongue muscles. Glossopharyngeal, it supplies only one muscle, that is stylopharyngeus, and lingual. Okay, lingual is sensory, it is purely sensory, it is not motor at all. It supplies anterior 2/3 of tongue. Let's go to the next one. The answer here is facial. It provides motor innervation to the posterior belly of digastric and also to stylohyoid muscle. That's the answer. Next one. Question: which nerve provides motor innervation to buccinator muscle? Ishita, this question is for you. Which nerve provides motor innervation to buccinator muscle? Now, buccinator, have you heard of buccinator? It also is pierced by the parotid duct. Parotid duct pierces it. And what is the action of buccinator? It flattens the gum against the cheek, and also it helps in prevention of any accumulation of food in the vestibule of the mouth. And you can also use this muscle to blow trumpet, to whistle, and all this. Okay, so buccinator. The buccal branch supplies, provides motor innervation to buccinator. Which one do you think? Buccal nerve, buccal branches, auriculotemporal, then you have mandibular, marginal mandibular. Which one? So your answer is B. The answer is correct. The buccal branches from the facial will supply the motor innervation to buccinator. And remember, these buccal branches of the facial nerve are motor nerves only. Okay, they do not do any sensory innervation to the area. All right, so that is the answer. Next one. Okay, so that we have reached the end of that session where we had some 7-8 questions. I hope it was helpful. I hope you were able to answer. I think RN, you and Ashu answered most of them, and it is good going actually. You have been doing well. And are you taking any exam recently, FMG or something? Which exam are you planning to take, and when is your exam? FMG. So you are taking in a month. Okay, so what about Ashu? Ashu is also taking very soon? Okay, fine. We lost her. Ashu, that I asked you whether you are taking any exam in the near future, like in a month or so. Okay, so if you are FMG students, you must remember there are a lot of straightforward questions. The questions are very straight, not twisted, turned, and things like that. You have question bank where you can just look at those topics and topic wise revisions. You please continue doing and at least do 100 MCQs per day, and that should keep you at a very good track. Okay, very good track. So that is again with the questions, and we were watching right now. What was the subtopic? We are doing some MCQs on the head and neck sections. Okay. So here there is one interesting thing that I want to tell you. There is NEET PG Combat. Okay. Here you can enroll for this 60 minutes of test and 45 questions. Okay. You have at least 90 seconds per question. It is going to imitate the same exam like the one which is given to you. And it is on October 10th and 11 a.m. Okay, so please enroll. Use the code Rohini10 so that the people know that you are motivated and you want to use the code so that they will know from where exactly you are, going to make a decision to enroll yourself. So it is very important to enroll and then also use the code, invite code. And you can definitely, if I'm lucky for you, you can get one of the ranks. So rank 1 to 3, that will give you 1 year of PG subscription. And rank 4 to 10, 75% scholarship. 11 to 50, 50% scholarship. And also 51 to 200, 25% scholarship. So there are high chances that rank taking is a possibility. So there is about 1 crore rupees, given or set aside for this purpose. So you try your luck, you might be the lucky one. So plus subscription, you have access to both the live and the recorded sessions. Okay. So where you can study on various devices, there is no restriction on any particular thing. And you can also access the QBank series. You can learn from top educators. You can see the live test and quizzes are possibility when you enroll. Then you can also get printed notes, okay, with the 12-month subscription. And you can also see there is a raise a hand feature where you can, raise a hand and ask question, and you will be able to get the answer to your question because there is one-on-one discussion in a live class also. So that feature is enabled and you can make use of that to ask questions. There are so many parallelly running, classes going on like the Mission INSCT and also procedures batch. All these batches have got very fast-paced educators where they are going to teach you and they're going to guide you, mold you. So join all this. If you're already a subscriber, you're already a subscriber to this, please join all this. And you can also see there is iconic subscription with the Prep Ladder and Unacademy. So this dual thing you can get with the iconic subscription. So you can subscribe to this and you can get the double benefit. And here you can see special class features are interactive live classes like we are doing right now. Jayashree and Avdesh is little late, otherwise you would have been interacting with them even more, right? And there is also polls for the learners and raise a hand feature is there. You'll never miss a class because you are always, going to get the notification before the class commences. And lecture notes are available anytime you can access. All this is a possibility with the special classes. And you can see that there is effective QBank of series that you can get, and you can, based on the latest exam pattern, all these are designed, and it also includes detailed explanations. And you can see there is limited time offer. Here, the Unacademy and Prep Ladder, both of them, you can get access to with 12-month subscription, 38 to 50. So all this is again using the code Rohini10. Okay, so you have first 500 student, you will be the one to grab it. And some of the students, they wanted to know how to get into this session of special class. You can just, log in and use the code ROHINI10. So when you use this code, when you hit the notify me, you will get a pop-up like this, which says invite code. And this is the code you're going to use at this point, and you're going to unlock the special free class. Okay, once you have unlocked, you will be getting notifications on the classes that's going to start. So what you can do is you can pass on this message to your friends and ask them to join all those special classes. In case they decide to join, this could be taken as a demo class also. Okay, so this is my profile and I invite you to follow me so that you can interact more with me. And this is again going to also invite you to join all the group. You have Let's Crack NEET PG and also give me a second. Okay, so here we have okay, so now join this and also join the Let's Crack NEET PG. Okay, so join this Telegram group where you can have access to about almost all the exam educators, and you will also get the PDF notes of many things. All the subjects, all the 19 subject educators will be there. So join these two Telegram groups and you will be able to definitely make best use of your association with Unacademy, believe me. And this is some of the star learners where who are going to motivate you. You can see all these are FMG students. RK, you can see all these, not RK, RN. So you can see all of these have scored more than 200. Okay, so how is that possible? Because of their continuous dedication. If you are dedicated, nobody can stop you from getting those high scores. So definitely they'll get into some very good college. You can also do so by getting motivated. Okay, so you will definitely do, because the way you answer, I can gauge that you will definitely get. So these are some of the parallelly running courses. Target Next integrated batches with me taking the respiratory system for now. Okay, this is what I'm going to take, respiratory system. And now my class starts around 9:30 p.m. and it's going to go on till 11:30. So please watch me at this time and join my session. We'll do lots and lots of MCQs. We'll look at some radiology images, and we'll also look at some other images, okay, from the respiratory system. Then we also have clinical examinations and procedures batch group here. These are the educators, and you can also see there is 24 plus 4 is the subscription, 4-month subscription free. So whenever you go for 24 months subscription, you will get 4 months free. And this will be added within even 30 days. Okay, you just 30 days, you will get this one added to that. So altogether, you will have some 28 months of subscriptions, almost kind of 2 years plus. So this is going to be definitely nice. So if you are in your second year MBBS, this will be the right time to take this, because that is when usually students start. Second MBBS students are the ones who usually start their preparation, because they feel that they have won half the battle, and they feel that they should be preparing. Okay, at least they can complete the part 1, because all the pre and paraclinical subjects will be there. Boost your medical PG preparation with this offer, 12 plus 2. So here also you will get 14 months, and 14 months is also good. You can use the code to get 10% discount. What is the code? It is my name with 10 added to that, Rohini 10. So don't forget the code. Pass this as much as possible to all your friends. So you want to gift somebody, you can just gift the subscription itself. So that is also a nice idea. So this is again NEET PG subscription. You can see there is Iconic and Plus, where you can go with the code ROHINI 10, and a minimum of 6 months of subscription we look at. If you have 6 months of subscription, then you have been kind of getting an eligibility to go with the EMI option. So it will cost you 1125 or 1404 something for Iconic, and little less for the Plus. Okay, there are various options also. Number of months also you can decide whether you want to go with 6 months, even 1 month. Every month you can renew with a new subscription. All these options are there. So you can just more the number of months you take, you will have to pay less amount. So, and you'll also get a lot of credit points. So credit points you can get. So many options are there. Just go have a look at what are the options you have to get the subscription. So it can be iconic or plus subscription. So plus will have access to just Unacademy, and this one will have access to both the Unacademy plus the prep ladder. Okay, so you can look at all this. All right, so that is what I wanted to give you information on, and let's see what we have. There is this is for all those who didn't join my 6 p.m. class. We were talking about the parotid gland. We talked about what type of gland it is. We talked about the duct, Stenson's duct, and what are the 3 structures it pierces. Any idea, RN? What it pierces, Stenson's duct? It pierces 3 B's. It pierces buccopharyngeal fascia, buccimeter, and buccal pad of fat. Okay, so we talked about the blood supply, innervation, then we talked about the neurovascular supply. Remember the auriculotemporal nerve. There is also the supply from the glossopharyngeal, and then we talked about what are the structures within. Okay, then embryologically it is ectodermal in origin. Unlike the submandibular and sublingual, they are endodermal in origin. And many disorders are there. We talked about all this. One of the important disorders is the infection from the virus, and also the infection of the parotid gland, parotitis, and also the stone formation. So this is the gross anatomy, and we talked about the histology, we talked about relations of the parotid, then we talked about the Fraze syndrome, and also the structures inside FEAR. There is infection cannot just be from the mumps infection, but it could also be from various other sources. And this is how the submandibular will look like. Submandibular is below the mandible, just below the angle of the, below the chin. And you can see that it is in the digastric fossa or submandibular fossa. And you can see how closely it is related to the external and the internal jugular vessels. Okay, you can also see the sternocleidomastoid, cervical plexus, all that you can notice in the neck along with the strap muscles. Okay, so location is there. It's a mixed gland, and the blood supply and innervation is same as sublingual. And this is the stone formation that can happen, and it is very common in case of submandibular duct, that is called Wharton's duct. And sublingual is beneath the fold of the sublingual gland and sublingual fold, and it is a mucus secreting gland. And blood supply innervation is same. What is the name of the duct? Many people don't know this. It is called Bartholin, and minor sublingual ducts are called Rivinese. And there are clinical aspects also associated with that. That is, it is more prone to bacterial and viral infections. Okay, so these can affect it very easily. And it is, again, any infection, inflammation of the tongue can also result in inflammation of these structures. Okay, so with all these things, I would like to end at this, and I would like to, welcome you all for this plus classes. If you are a subscriber, please do join my plus class that is going to start at 9:30 today, 9:30 p.m. and it is going to be up to 11:30 p.m. Okay. And this is on the respiratory system. We have covered about 6 hours of respiratory system. We have 6 more hours to go, and today we have 2 hours, and this is for you. All right. So respiratory system, 9:30 to 11:30, and we are going to do a lot of MCQs today. So that's it, and thanks for watching. This is Dr. Rohini signing off. All right. See ya. Good night, all of you.